And Dr. Dan Tomlinson is here. Dr. Dan, thanks for being here with us.
Great to be here. I didn't know I was going to make it there for a minute.
Yeah, I know. An emergency popped up. Well, we have some athletic questions for you tonight. First up, a lot of parents are asking about their football players.
Right.
What are the signs of a concussion, and what should be done about that?
Well, that's big news right now, as you know, because of the NFL. And of course, if an injury, you lose consciousness. But also, if a player's disoriented a bit, the NFL has a thing going on now where they also talk about these chronic kind of lesser impacts to the head. So we're really telling coaches and so forth not to teach the young men to lead with their helmet. Like you see some of the pros doing, that is what you totally don't want to do. Is that back and forth movement, really quick acceleration, deceleration of the brain in that helmet. You don't want to have happen. And you'll lose third grade, second grade if you have that happen to you too many times.
Well, also we have another question. Should runners and other athletes, like endurance athletes, change the way they warm up in the winter months?
Okay. That's a great question, because the answer is yes. There's two things that are going on that can set you up. First of all, the muscles are tighter. They're closed down when it's cold, and so you need to stretch them out, because if you won't, what they'll do is they'll pull against the tendon sheath where the muscle inserts into the bone, and that's what's a pulled muscle is. It's actually, you get inflammation of the little non-muscular portion because the muscle's trying to do its job, but it's too short. So you need to stretch them out by heating them up. And the other thing is, when it's cold, people mentally are feeling like, hey, let's get out, I want to run. It's cooler, you have more energy, and so it's a kind of a double whammy. So you definitely want to start out with low impact before you get going into high impact kind of aerobics when it's cold.
When it's cold, I want to sit on the couch and take a
Really?
nap.
Oh,
Yeah.
okay.
Some
I'm
chili.
just the opposite. I want to get out and do stuff.
All right, Dr. Dan, thank you. And we'll be right back with more News 10 at 5.